I just wanted to record this for the sake of people, to show what next for you and how you have to go about doing this course. So let me share my screen and let's see if you guys can see this. Um, can you see this? Can you see my screen, Malati?
Can see.
Awesome.
Yes, I can see. Yeah.
So you're going
Yeah,
to get a bunch of
I can
emails.
see.
Don't get scared about emails. There's so many emails coming your way. They're going to send you a DocuSign to sign. They're going to send you the calendar that I'm going to show for the next 3 months. They're going to send you an LMS link. This is our portal where we have the recordings and stuff. So you're going to get a lot of emails from tomorrow to probably end of this week. And you'll also get access to Argus at some point in the course. You don't need Argus access right now, but it's also provided in the course. So first thing you got to know is once you get access to LMS, which is our learning management system, you'll have a username and password. It will be emailed to you. The link will also be sent in some similar email from students at MediPharm Solutions. This is the email. So you just log into your portal. And once you log in, this is an admin account, you'll see all the courses, but for you, you'll only see advanced drug safety and pharmacovigilance. And you can click on this, you'll see all the modules that we're going to teach. And just click on one of these modules. It's easier if you do that. Just click on this module and you'll see all modules. So there are 3 pages of modules, roughly around like 40 or 42 modules. And I'll go through the modules like in the way that you need to prepare. But the most important thing that you have to know is where is the content that you have, like for example, where is the content from today's module? So this would be in introduction or somewhere probably prior to history of pharmacovigilance. So if you see your email today, it would have said, this is a topic, introduction course navigation by me. So what you have to do is, this is what you're going to see tomorrow, probably prior to history of pharmacovigilance, just introduction and course navigation, and you will see a video. So what you have to do if you want to review that is pretty much click on that module. Like for example, if you on September 6th, let's say you're doing ADR, you'll get an email saying that we are doing the module on adverse drug reactions. You can just click on it and it will pretty much say September 2022. You don't need to watch all the videos from May, June, July, August. You don't need to do that. The content is the same. We just have them there, and sometimes we kind of wash it in such a way that only 2 prior classes are there. You don't need to watch all the classes. Just watch what is the current one, which is pretty much where you guys are. So you belong to September batch because we start on September 6th. So just watch the video if you want to review it, and you can pause, fast forward, rewind, or whatever you want to do to get some questions answered. And there are some handouts. These are actually done by the students themselves, like whatever notes they can do during the classes, they kind of did it. We just took it from them. So you can go through their notes, write your own notes, however your learning style is. And all the core modules, I'm going to go through the course, how it is divided. You will understand what is core modules. So all the course, you don't need to take screenshots. It's not required. All the PowerPoints will be sent to you by the end of the month. So there are 18 core modules that we teach in this course. All 18 of them, I believe 16 or 18, all the PowerPoints will be sent to you in one email. So you will have them. So you can print it out and you can write on them if you want to. So that's all structured. So you don't need to do any kind of screenshots or anything. You can just read through it. So the important thing is, once you're done with it, just hit complete. So every time you watch a video, hit complete. Every time you are reading through like a handout, or you're doing a quiz, just hit complete. So as you keep going towards the end of the course, you pretty much will complete all the steps. Like there are 63 steps, I believe. So whatever are the 63 steps, once you complete it, you'll get a final assessment. Pretty much 50 questions, and you need to get 40 right. and you can print your own certificate. So the whole point of the course is not to print a certificate, is to get through your job placement, marketing, and get into a career through this. So that's pretty much how you do the course. You just complete each module, complete it, and kind of keep moving forward. If you don't need to watch a video, if you don't need to do any of the handouts, that's okay. Just hit complete so you know you have done that module. And every module has some interview questions. Like, for example, this module has one quiz. Like, you can just hit on this and it will start the quiz and you have to answer the question. So again, there are no set limits how many times you can take the quiz. You don't need to get the 10 out of 10 right, but you have to make sure you go through this, because these are all interview based questions. People already ask us like, okay, can you give us a list of frequently asked questions? We don't provide that because we do not know what questions will be asked. It's easy to understand the concept, understand the story, and then come up with answers for the questions in the interview. So all those frequently asked questions are pretty much in this questions, and this is the same thing that you're going to see in your final assessment. So it's really not stressful when you kind of prepare one module at a time and get it done as we go through the course. So there are some self-learning, like there's nothing to teach there. You just have to go through it just to get an idea. Like, all this first 6, I believe, are self-learning, 6 or 7, and then we have core modules. What do you mean by core modules? Is these are the modules that are always kind of assessed in the interview process. Whichever title you take, whatever is the job description, basic questions will come from this core modules, and that's why they are in sequence. So you need to really know this core modules until from adverse drug reactions to safety databases. So there are probably 16 or 18 of them. You need to know them in and out. And then we go into Argus, which is pretty much where we are going to start in September. You don't need to learn Argus everything in detail, but you need to know how it works and how the layout is. And you don't need to do any cases right away. You don't need to do any case processing right away. Understand pretty much the layout and get yourself familiarized with Argus. Again, I repeat, you don't need to do any case processing in Argus probably until the end of September. And it's not required because it's not even asked in the interview, but you need to know how to process a case. You can just practice a case and say, okay, this is what I'm going to do if I'm data entry. If I'm going to do medical review, like some of you are physicians. So if you want to do medical review, this is what I'm going to do. So if you go through it one time and kind of get into a point of view that you know how to go from screen to screen, it's pretty much like creating a Word document. You do not know how to create a Word document initially. Now you know how to create it. That's pretty much what you do with case processing. Don't spend too much time and energy in learning those things. So that's what we do with Argus. And then there are some miscellaneous topics that you can see after Argus case processing, their follow-up, product quality concerns, targeted medical events. So there are a lot of other modules. These are pretty much dynamic based on the job descriptions in the current market. We keep adding some modules so that you will get the information when, you'll get an email saying this module was added. So if you know the core modules, if you kind of understand the subject in that 16 to 18 modules, which are pretty much 1 hour long, you would be able to understand the rest of the modules very easily. But do not focus on all the modules for the interview. Just focus on those 16 to 18 modules. Get to the bottom of them. Now, if you need a textbook, if you want some reference, if you want to, kind of look at a word, this is a book. If you want, you can just buy it on Amazon. It's like for $30-40 there. You can, this is actually second edition. Now there's a third edition in Amazon. This is a good book. But you don't need to read this cover to cover because it doesn't say anything about 9 to 5 perspective. So it's a good book to have just to, kind of get to know the words and get to read through what is the, I would say, information around a word that you want to kind of learn. But you don't need to read this, completely from cover to cover. This is just like a reference book. And the final thing is the success stories. This is where you will see tons of videos from different people coming on the class and taking the class and telling their story, like where like, you know, how did they go to the interview, what happened. You're going to learn a lot from them. Some people require it, some people don't, and I leave it to your discretion to figure out if you want to go through all those videos. And as you keep going through the course, you'll get more content. That's how the whole thing works. You might not see everything on day one, but you'll see all of them in that. And then the final assessment is what I was talking about earlier. And most important, keep this thing mark complete every time you go through the module. So that's about how you navigate the course, how you complete the course, and how you can print your own certificate. You can just go into your account here, put your first name, last name. Once all modules are done along with your final assessment, it will say print certificate in your account. You can put your first name, last name, and you can really print your certificate. So that's how the whole prerequisite for printing a certificate is. Of course, if you need any help, students at medipharmsolutions.com, Rohita, Rakshaya can really help you with printing your certificate. That's no big deal. So main thing is look at the topic for the day, and you match this topic with what you see in the module. Like for example, when you dial into the call on September 1st, you're going to be starting with Argus. So it will say Argus case processing book-in. And now here, if you go back, you will see September 2022 on September 7th. So one day after, you would see the recording. So you can go through the recording, and it's automatically uploaded the next day. So that's how the sequence is. So you'll be emailed this video. You'll be emailed the LMS access. You'll be emailed other bunch of stuff with the DocuSign enrollment terms and conditions that needs to be in place for us from a business standpoint, just to protect ourselves. And the second thing is you'll be given this LMS access as step one, along with some videos on navigating and all those things. So this video will be there for you. Now, the second thing that I also wanted to do, let me stop recording here because I need to break this video.